Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole durant la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef, le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick.
Bonjour, cet après-midi prendront la parole la Dr. Jennifer Russell, la médecin hygiéniste en chef, et le Premier ministre Blaine Higgs. Dr. Russell. Merci, Bruce.
Good afternoon.
Bonjour. Avant de commencer mes remarques officielles, je tiens à remercier sincèrement tous ceux qui suivent les directives de la santé publique et qui s'efforcent de limiter la propagation de la COVID-19 au Nouveau-Brunswick.
Je remercie également toutes celles qui choisissent de rester à la maison lorsqu'elles se sentent malades. Enfin, je remercie toutes les personnes qui lavent leurs mains, respectent la distanciation physique et surveillent leur...
Your efforts show that we show our success. Yesterday, we learned that someone passed away from COVID-19.
Able to wear a mask when they go out, I say thank you. To everyone who is staying home when they don't feel well, I say thank you, and I thank you to their employers who allow for them to stay at home when they're not feeling well. To everyone showing compassion, I thank you. To everyone who is washing their hands, maintaining physical distance, and monitoring their symptoms, I say thank you. To everyone supporting their fellow New Brunswickers during this difficult time, I say thank you. We literally could not do this without you. I also want to offer my condolences to the family of the individual who died from complications related to COVID-19, which was reported on Wednesday. I ask all of you to keep this family in your thoughts as they grieve for their loved one. Je tiens à offrir mes sincères condoléances.
I want to offer my condolences to the family of the individual who died from complications related to COVID-19, which was reported on Wednesday, and I ask all of you to keep this family in your thoughts as they grieve for their loved one.
The COVID outbreak and the well-being of the people in Zone 5, which is deeply concerning to my team and to all the people of New Brunswick. Public Health recommended to Cabinet today that Zone 5 remain in the orange level of recovery, with some additional restrictions to limit the spread of COVID-19. This decision was not taken lightly. There were many discussions with our epidemiologists, our public health staff, our medical officers, RHAs, and really considering all of the things that we need to do to have the outcome that we're looking for. And the outcome is to end the outbreak as soon as possible. And so as of midnight tonight, we are asking residents to limit their contact to a single household bubble. We've been seeing transmission within family and social and workplace settings, and so this is one of the measures that we know will help stop the spread. Aujourd'hui, la santé publique a recommandé au cabinet de maintenir la zone 5.
Today, Public Health recommended to Cabinet that Zone 5 remain in the orange level of recovery with some additional restrictions to limit the spread of COVID-19. As of midnight tonight, we are asking residents to limit their contact to a single household bubble.
Since the beginning of the pandemic and have expanded the single household bubble to include caregivers and immediate family to help with the daily functions of their life or to prevent the mental health toll of isolation. But expanding the household bubbles too widely, obviously in the situation that is happening right now in the Hamilton-Restigouche area, we cannot continue and maintain. So that is why we're asking for these changes to be made immediately at midnight. Même si nous reconnaissons l'importance de cette mesure, je demande à tous...
While we recognize that important distinction, I want to ask people not to take advantage of that to organize things like a large family parties or dinners. These events are where we are seeing the virus spread. Keep your circles as tight as possible within the rules in the hopes that this measure will be temporary as we get the virus under control in the region.
other provinces, including Alberta, where it is the size of gatherings that is really influencing the transmission of COVID right now. COVID-19 does not respect our health zone boundaries. Belledune, which is not in Zone 5 but is in the area of risk, will be included in these measures. Kedgwick, which is in Zone 5, is being exempted due to lower risk in this community. I want to stress not just the seriousness and the severity of the situation in Zone 5, but I want to impress upon you the urgency of the situation. The spread of COVID-19 presents a grave risk to everyone in this area, and thus to all of New Brunswickers, including, again, the effects on the social determinants of health in that area right now, specifically around income, mental health, and hospital services. So we really, really need to have concerted efforts right now and give our attention to that area. Public Health will continue to monitor the situation over the coming days and has been monitoring from all different places in the province. So we have teams united in terms of public health staff from Vitalité and Horizon working round the clock to really do the contact tracing and contain this. So we have to consider more stringent measures right now to limit the spread of infection. If people's close contact numbers are reduced to 1 or 2 or 3, then we can really get this under control very quickly. Today, there are 3 new cases of COVID-19 in New Brunswick, and the new cases are all in Zone 5 and are as follows. An individual aged 40 to 49, 2 people aged 50 to 59, and all 3 cases are under investigation. Aujourd'hui, il y a 3 nouveaux cas.
Today, there are 3 new cases of COVID-19 in New Brunswick. The new cases are all in Zone 5 and are as follows. An individual aged 40 to 49 and 2 people aged 50 to 59, and all 3 cases are under investigation.
COVID-19 are part of learning to live with this pandemic, and we expect to see them, and we are prepared to address them when they happen. I wish we were an island like Australia or New Zealand, but we're not. We do have people coming across the border every day, and even though we've done everything we can to keep those numbers as low as possible, it will never be enough to stop the transmission from occurring. As we see the numbers increasing outside our borders in Maine, in Quebec, in Ontario, and across the country, it is really heartbreaking to see this surge happening outside of our borders, and it can have an impact on New Brunswick as a whole. So we really have to always be vigilant no matter where we are in the province. The outbreak in Zone 1 has been brought under control, and we are seeing fewer cases related to that outbreak and have identified links among all the reported cases. Today, Cabinet has confirmed that Zone 1 will transition back to the yellow phase of recovery effective at 12:01 a.m. on Friday. We don't want to impose measures unnecessarily or longer than necessary in any outbreak situation. It's balancing the risks with the mitigation or the management of those risks, and they should be proportional. The situation in Zone 5 is serious. I know that people in the Hamilton-Restigouche area feel targeted and shamed by the outbreak, and I am not here to blame anyone, and I want to be encouraging and optimistic and promote cooperation in taking on this challenge. We need everyone's help to address this public health crisis. And on my walk here, I was trying to think of a way to characterize the risks currently that exist in the north, and some of the risks pre-existed COVID in terms of people with chronic diseases, people who may not have as much access to in terms of the social determinants of health that pre-existed COVID-19. So during COVID-19, we are seeing an exacerbation of people that were already at risk with respect to the social determinants of health and that increase. So, and the fact that they're close to a border with Quebec where the numbers are increasing. So when you go camping, if you know there are bears around, you take your food and you tie it up in a tree and keep it far away from your tent. And, you know, that's supposed to keep the bears from attacking and to getting at your food. But if the bears are numerous and you can't really really assure your safety, you probably shouldn't go camping, and you should probably stay in your house. And by that, I just mean the risks of COVID around the country are increasing, and so it's hard to not have that increased risk impact us here in New Brunswick. So even if we do everything right, even if you did tie your food up, sometimes the bears come around anyway. So we just have to take every precaution that we can right now to protect ourselves and protect our loved ones. And there are facts about the outbreak with respect to Hamilton-Restigouche that all New Brunswickers need to understand. The first case in the Zone 5 outbreak was reported on October the 8th, and 11 cases reported the next day, leading to a decision to transition the region back to the orange level of recovery. And then within a week, the number had jumped to 43 cases, and that was in Zone 5. Yes, Zone 5. In the past week, the number of cases in Zone 5 has grown to 69, including 2 individuals in hospital and 1 death, unfortunately. We have at least 4 separate chains of infection, which we can't link to the larger outbreak. And this is a strong indication that there is community spread happening in Zone 5. And so public health continues to investigate the sources of these cases. In the course of our contact tracing, many hundreds of people in Zone 5 have been told to self-isolate in an effort to break these chains of infection. That is the only way to stop this. If I could wave my magic wand right now and tell everybody to stay home, then we would be able to stop it. We would see it stop within 14 to 28 days. But some people have to go to work. Some people, we would like children to still be able to go to school. So there are essential things that have to happen to keep the economy going, to keep our mental health protected, and again, look at all the social determinants of health in terms of healthcare services, et cetera. So some of the individuals work in our healthcare facilities, our schools, and their absence from the workplaces is putting a significant strain on our ability to deliver services in that region. That is a huge risk right now, and we're trying to manage that as well. So I am very concerned that the public health measures aimed at slowing the spread of COVID-19 have not been as successful as we would like up until now. And as I said, if I could wave my magic wand and have everybody stay home for the next 14 to 28 days, we would see this outbreak come under control in that way. But that is too harsh a measure to impose at this point in time. And so we are just really trying to get people to be extremely vigilant. The people who have been vigilant all along, great. We just need everybody to dig down a little deeper to make sure that we can keep the Hamilton-Restigouche area in orange while we deal with this outbreak, and so that we wouldn't have to go to the red phase. We continue to see evidence that the disease has been spread through social activities, public gatherings, and in workplaces. So we need everyone to do their part to bring this outbreak under control, and we know we can do it. We know that. We've done it before. So what we do today will affect what we see a week from now, 14 days from now, etc. So all the actions that we take today matter. And we now have a situation where COVID-19 is more prevalent in Zone 5 at a population level than anywhere else in Atlantic Canada. So we've seen that in a 16-day span, we've had 14,000 COVID-19 tests in New Brunswick, and less than 1% of these were positive. And during the same period, 1,500 tests were administered in Zone 5, and 4.24% of these were positive. So New Brunswick is currently seeing around 14 cases of COVID-19 per 100,000 people. And during the outbreak in Zone 1, the local rate was 18.49. And in Zone 5, the ratio is 245 cases per 100,000, and that's really in a 12-kilometer radius. So if we compare that to the national rate for active cases in all of Canada, that is 61 per 100,000. So 61 per 100,000 in Canada at the population level, and in Zone 5, it's 245 cases per 100,000. And that's why we are so concerned. And again, that's why we are imploring everyone to do their part at this time. These figures illustrate why we need to get this outbreak under control quickly as we can. And again, staying in the orange while we do that is better for income and mental health and things like that, and keeping our schools open. So we would like to be able to continue to do that, but we need everyone's cooperation. Pour que nous puissions dresser un portrait clair de la
To get an accurate picture of the prevalence of infection in Zone 5, Vitalité will be conducting mass testing for COVID-19 in the area this weekend. We are asking that anyone in Zone 5 who believe they have been in contact with a COVID-19 case but are currently not displaying symptoms to get a test. Testing will be available without an appointment at the Regional Civic Center in Campbellton on Saturday from 9 a.m. to 7 p.m. and at the Inshare Arena in Dalhousie on Sunday from 9 a.m. to 7 p.m. We are aiming our testing efforts at those who are showing no symptoms but are at risk of carrying the infection. asymptomatic people do not need to self-isolate. Oh, that is a mistake. So, need to self-isolate while awaiting results because Zone 5 is really vulnerable. Residents in Zone 5 who have symptoms currently displaying COVID-19 symptoms are asked to use the online self-assessment form or call 811 to book an appointment at the testing site nearest their home. The cases we see that there are very minor symptoms that people have ignored. So even though you think it's just a little cold or having the sniffles, it's important that you stay home. You cannot go to school, you cannot go to work, you cannot go visit your family.
They have been in contact with a COVID-19 case, but are currently not displaying symptoms to get a test. Testing will be available without an appointment at the Regional Civic Center in Hamilton on Saturday from 9 a.m. to 7 p.m. at the Inch Aaron Arena in Dalhousie, and on Sunday from 9 a.m. to 7 p.m. We are aiming our testing efforts at those who are showing no symptoms but are at risk of carrying the infection. And normally, targeted testing is very important. And in this case, the asymptomatic people that we're trying to target at this point in time will need to self-isolate while waiting for their results. And the information that we gather from this testing will definitely inform our next steps. Residents who are currently displaying COVID-19 symptoms are asked to use the online self-assessment form or call 811 to book an appointment at the testing site nearest their home. And any news of any further restrictions will be hard for the people of Hamilton-Restigouche to hear, and that's why we're trying to help the situation today by putting these other measures in place to see that if we can really clamp down and get this under control as quickly as possible. They have been through 2 regional outbreaks since the pandemic began, and we don't want to see any more hardships imposed on anyone unnecessarily. Again, our measures have to be proportionate to the risks and the managing of those risks. The border proximity is not ideal. Again, I said before, I wish we were an island like New Zealand or Australia, but we're not. And the measures that we are putting in place right now are vital if we are to prevent the further spread of illness and death, which the region is now experiencing. And again, sometimes you can do everything right and you can still have problems occur in terms of infection. But right now, let's all focus on doing our best to get this right at this time. Bringing Zone 5 back to the yellow level of recovery with the rest of Nouveau-Brunswick will require concerted effort by everyone in the Hamilton-Restigouche region, but it's also involving people from all around the province right now who are chipping in and helping with respect to contact tracing, etc. We would love to hear shout-outs from other zones in terms of, you guys can do this, we got this, we're all in this together. Please limit your contacts to 1 household bubbles. When you do go out, limit your contact with others and maintain 2 meters of physical distance. Assume that everyone has COVID-19 and act accordingly. Wear a mask when you go out and keep a spare mask with you at all times. Monitor yourselves and your family for symptoms of COVID-19 and seek testing as soon as symptoms emerge. If you don't feel well, even slightly under the weather, don't take a chance, stay home, don't risk infecting others. Si vous ne sentez pas bien, ne serait-ce...
If you do not feel well, even slightly under the weather, stay home. Don't risk infecting others.
Outbreaks resulting from people going to outside of their homes with what they just thought was a cold. So taking a day off can literally save lives in this outbreak. Getting tested can save lives. Wash your hands regularly and thoroughly. Follow all public health directions, as no single measure will make the difference by itself. They are designed to be used together to keep you and your loved ones safe and healthy. Our lives, our livelihoods, our mental health, our physical health, our education, all of these things matter and are important at this point in time in how we go about managing COVID-19. And I do want everyone in the Hamilton-Restigouche region to know that you have the support of every New Brunswicker. If you have friends and family in this area, please reach out to them and let them know that we are all thinking of them. I am convinced that the measures being announced today will make a difference in arresting the spread of COVID-19 in Zone 5. By working together and supporting each other, I am sure that we can get through this. We have done it before, and we can do it again. Thank you very much. Merci.
Good afternoon. Bonjour. Yesterday we learned of the death of a fourth person in our province related to COVID-19, an individual from the Campbellton region. Je veux joindre ma voix à celle de...
I would like to join all New Brunswickers to convey my most sincere condolences to the family and friends of this person, as well as all the people who are still impacted by the recent outbreak. My thoughts are with you during this difficult time.
Sad reminder of the severity of the situations we are currently facing. We have to remember that this is a person with a family who loved them very much, and a family who is now in mourning. We often hear that the people who are most severely affected by COVID-19 are those with underlying conditions. But we must also remember that if they had not contracted this virus, they would not have passed away when they did. They would have had more time to spend with their loved ones. Right now, up to 300 people in Zone 5, Campbellton region, are self-isolating because they are considered to be a high risk of contacting the virus. I'm saying all this because I want to remind all New Brunswickers of the impact this outbreak is having on so many lives. Je demeure très préoccupé par l'éclosion dans la zone 5.
I remain very concerned by the outbreak in Zone 5 in the Campbellton region. The number of cases keeps going up in the region, while public health keeps investigating. We cannot find the source of the virus in some cases, and we don't know where the outbreak came from.
This weekend in Dalhousie and Campbellton. Staff from all regions are already heavily involved in containing the outbreak. I'm told that volunteers are staffing phones and calling from Zone 2 in my region back home. So all over the province, we are working to safely see Campbellton and the region turn back to Zone Yellow. C'est un véritable travail d'équipe. Je remercie.
It is true teamwork, and I thank all the people who are working tirelessly and all the people who will keep on working hard in the next days to help contain the situation.
We made the decision to move Zone 5 to the orange level because we are hopeful these stricter measures would help contain the spread of the virus. But it has become clear that this by itself has not been as effective as necessary. And that is why, after discussing the matter with Public Health and with Cabinet and the All-Party Cabinet Committee in COVID-19 earlier today, we have introduced the additional restrictions. As Dr. Russell said, as effective as midnight tonight, residents in Zone 5 will need to stay within a single household bubble. You know, if you think about this, it's a small price to pay to try to bring this zone back under control, to ensure that a further lockdown and going into another code, Zone Red, is not required. We'll assess these activities through testing, through adherence, through additional staffing of compliance officers, and yes, fines if necessary, because we must get back under control. Campbellton and the entire northern region is a key part of our province, a province that is being known for its effective handling together of the COVID-19 outbreak. We are rebounding as a province, as we must. We're rebounding as one. We need the northern region here to be back with the rest of the province as we see people looking again across our province and a renewed interest in the entire province of New Brunswick. As Dr. Russell explained, this includes, in every case where we're looking at the household bubbles, it includes as well caregivers and immediate family members. It's going back to what we were many months ago. Contacts should be limited as much as possible, and you cannot spend time with anyone outside of this bubble. Our hope is this change will make it easier to contact trace and that we'll be able to keep the virus contained. We have certainly seen and heard reports of large gatherings, house parties, individuals that have, for whatever reason, decided that the COVID-19 is not within their reach. Well, if it's not within your reach, maybe it is in the reach of your parents or your grandparents, and maybe you'll be the transmitter that won't know it, but you'll be the reason for a very unfortunate outcome. For now, Zone 5 will remain in the orange level, but only for now. We'll be doing a lot of work over this coming week, and these additional measures in place will help us to determine the next steps. In addition, another consideration, non-essential travel to and from Zone 5 is highly discouraged at this time. Si vous demeurez dans une autre région de la province et que vous devez aller dans la Zone 5,
If you live in another region of the province and you have to go into Zone 5, take necessary measures and respect the orange phase rules when you come back for 14 days. And if you live in Zone 5 and you have to go in another region of the province, I'll ask you to respect the restrictions of the orange phase everywhere you go.
And enforcement to make sure everyone is following the rules. Just yesterday, these officers visited 29 businesses in Zone 5. They inspected the premises, checked for operational plans, and made notes of mask adherence and usage. Compliance orders were issued to 5 businesses that were unable to provide valid COVID-19 operational plans. Officers will be following up with those businesses over the next few days to ensure these plans are in place. If they are not in compliance, the next step will be to issue fines. This isn't a step that we wanted to take, but we do expect compliance from all businesses and individuals. And we do need that to control this outbreak and to ensure that we can move the community back to the yellow phase.
For now, people in Zone 5 can expect to see more officers from justice and public safety than usual. The officers will keep on focusing on awareness, on raising awareness. But if people refuse to respect the rules, they will be penalized.
Essential workers who travel. I expect that we'll have more details on that when they are worked out in the days ahead. Pour le moment, je veux rappeler que toutes les personnes.
For now, I want to remind you that all people who go outside of the Atlantic bubble for non-essential reasons must isolate for 14 days when they come back to the province.
Continued to move in the right direction. We have not seen many new cases in this area of the province, and we have been able to quickly find the source of cases through contact tracing. The diligence of our health team in tracking down and identifying is so important for us to be able to move back in this region, back to the yellow phase. So as expected, Moncton will be returning to the yellow level as of midnight tonight. This means people living in Zone 1 will be able to reconnect with close friends and extended family outside of their 2-household bubble, although groups should continue to be limited. Les rassemblements publics de 50 personnes ou plus, l'intérieur et l'extérieur.
Public gatherings of 50 people or more, inside and outside, are authorized again, but physical distancing must be respected. All businesses and activities that had to close during the orange phase can open again as long as they respect their operational plan guidelines.
Public spaces and unofficial indoor public gatherings, they are not mandatory when participating in outdoor activities in this zone. Zone 1 is a positive example of what can happen when everyone follows the rules. But we cannot take the risk of allowing COVID-19 to continue to spread in Zone 5. We need every single resident to do their part. Otherwise, we'll have no choice but to move further back into a higher level zone in Zone 5, a higher level that would be Code Red. Think about the impact this has. Think about the impact it has on schools closing, parts of the economy shutting down. So it's not about anyone as an individual, it's about your entire community. And it's about doing your part. So if you're able to help our officials as they're trying to trace how you experienced your COVID, if you've had the COVID or you have it now and been diagnosed, you need to disclose any information you can, because that helps us. If we're able to trace and we know where it came from, then we're able to continue to move in a positive direction. But when the unknowns are there, it makes it very difficult and almost impossible to maintain and get back to a reduced level of urgency. So when I think about Hamilton Region and Zone 5, I think about we're on the verge of going back. We do not want to go to zone and turn it into a red. We do not want to shut down, because we have a balance between our economy and safety of our individuals. And we need to always be looking at how we're moving forward, but doing so safely. So we are on the verge of making a decision, though, that would significantly impact the economy and the livelihoods that are everyday experiences, but we need your help. Throughout the pandemic, New Brunswick has shown that it can indeed lead the way by slowing the spread and flattening the curve. Si tout le monde travaille ensemble et prend les règles au sérieux.
If everybody works together and take rules seriously, the whole province will be able to go back to phase yellow. Right now, we are going back, but by respecting public health orders and the emergency order, we will be able to go back to phase yellow.
But it's normal with COVID, and normal for as long as we're without a vaccine, but one that we can live with, and we can continue to grow and thrive and survive with. And once again, New Brunswick will be a leader in our country in addressing and dealing straight on with the COVID outbreak. Thank you. Merci.
Merci à toutes et à tous. Thank you all. We will now proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a quick follow-up. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions.
The media can ask the question in the language of their choice. You have one question and a quick follow-up. The Telegraph Journal.
Dr. Russell. Dr. Russell, does public health know how the Zone 5 outbreak started? And if not, is that something for us to be worried about?
Well, as I've said before, I wish we were an island so that we would be able to keep COVID out of our province, but we can't. So we do have many people traveling in and out of the province every day. Some of them are essential workers, and some of them have exemptions and work safe isolations, and some people don't, and some people can be asymptomatic. Because we couldn't trace it, the significance of that with respect to how it got into Zone 5, it meant that it could be community transmission. So we've been worried about this since the beginning. And then when we had two more unlinked chains of transmission, that made us even more worried about the fact that, okay, if there's community transmission, then what are the steps that the community needs to take? What are the steps that public health needs to take, the hospital system, et cetera, to contain the outbreak as quickly as possible with all the means that we have available to us? Again, knowing that whatever means we have available to us and whatever measures we impose have to match the risk in proportionality, knowing that any measures that we impose that are above and beyond the yellow phase can cause hardships from a mental health perspective, from an income perspective, from an education perspective, et cetera. So we are weighing all of these things, but again, the how it's transmitted into the community matters from a sense of knowing that it was linked, and we when it's linked to something, then we can assure ourselves that it's contained with respect to the contact tracing, and then we know that there's not community transmission. Obviously, in this situation, we know there is community transmission happening, and that's really concerning. So that's why we're trying to gain control of the situation by imposing the measures that we are today to avoid going to the red phase and keep, again, keep the schools open, keep business open, keeping people's mental health protected, et cetera. So that's our goal right now, is to get it under control as quickly as possible and get back to the yellow phase as quickly as possible.
Thank you, Doctor. Mr. Wall, do you have a follow-up?
I do, for the Premier. This is changing tacks a little bit. Premier, Liberal leader Roger Melanson put a press release out this morning saying that Dominic Carty needs to apologise for bullying the Auditor General. Does he need to apologise? Do you have any issues with the comments that he made about the report?
I think what Dominic said was in relation to expressing the need to look at the facts of how the school was selected. I wouldn't for a moment question that over the past there have been many schools that have been politically selected, but this isn't. I don't believe this is one of them, and I think the facts will show that very clearly. I think in that press release there was a reference to changes that were made that moved its priority. Well, I do believe the changes that were made and how the reporting or the analysis would be done were made when, in fact, Mr. Melanson was in government. I think they happened back in 2016 or 17, and I believe it reflected something to do with growing communities and how their needs could change. But those were the rules that were followed. I feel very confident that the rules were followed in that school selection, and I would encourage all of those facts to be evaluated and let the decision be made accordingly of how the process was adhered to.
Thank you, Mr. Wall. Thank you, Premier. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, the Cowles Regional Hospital confirmed 5 new cases of COVID-19 in the Cowles region yesterday. And beyond just the 7 New Brunswick mill workers who travel across the border every day to work at Woodlands Hall, many other residents of Charlotte County also travel into Maine each day to work in a variety of different jobs, grocery store clerks to hospital workers, and residents of Campobello obviously also shop there for essential goods. But when Charlotte County residents call 811, many of them are still being directed to get tested in St. John, even if they ask to be tested in St. Stephen. Is the St. Stephen satellite testing site open to everyone in the area, and are there plans of making it more permanent due to the continued outbreak in the Cowles area? And also, how concerned are you about the outbreak in Cowles?
Well, again, as I continue to say, that because the risks are increasing all around us, we know the case numbers are increasing in Maine, the case numbers are increasing in Quebec, Ontario, Alberta, BC. I don't think there's anywhere in the country and anywhere south of our border and to the west of our borders that the cases are not increasing. So I am very concerned about all of the case numbers increasing outside our borders, and that risk being the impact of those risks increasing outside our borders means that the risks are increasing inside our borders because of the travel back and forth. So the Premier mentioned that we will be implementing a voluntary testing strategy to address the essential workers who come back and forth across any border at this moment in time, and that would be a voluntary basis, and it would be 3 times a week, and that would be an extra measure of managing those risks. Again, we can't eliminate them completely, so it's a matter of trying to manage them. And with respect to the pop-up centers, my understanding is that actually there had been pop-up centers. I'm not sure the status of the pop-up centers right now, but I can definitely get back to you on that and get more information from my regional staff. But certainly, again, the risks are not going to decrease. They're going to continue to increase, and so we have to keep evolving and changing our strategies to address those risks.
Ms. Hogarth, do you have a follow-up?
Thank you, Bruce. Thank you, Dr. Russell. My follow-up is for the Premier. Premier Higgs, if the outbreak in Calais continues, will you consider limiting the number of trips or monitoring the trips Campobello Islanders take into Maine for essential goods? And are there talks of extending the Campobello ferry beyond December at this point?
Secondly, I guess in relation to the second question on talks beyond December, not that I'm aware of, that there's anything at this stage, not that I'm involved with in any case. The other case of ensuring that residents are able to get through Maine to get to New Brunswick, I mean, that has always been a priority for us, regardless of the situation in Maine, so that people can transit and get back into Canada. So we will continue to monitor the case there, but work with the federal authorities, and certainly we'll ensure that capability continues to exist, because we recognize the absolute importance of those residents to have access to their own country, and we'll ensure that takes place.
Thank you, Ms. Hogarth. Thank you, Premier. Timothy Jakes, Campbellton Tribune.
Yes, this is for Dr. Russell. And the question is, last week you said asymptomatic community testing wasn't necessary in Zone 5. You said we have seen that across the country and in other jurisdictions where asymptomatic testing is not really garnering results, that to point to its efficacy any longer from a human resources perspective, but also from a materials perspective and the equipment we need. So what's the reason for the change in view?
Well, certainly things have been evolving in the Campbellton-Restigouche area, and in terms of all of the things that we can do to target that population, because this is a very small population. There are only 12,000 individuals up there, or 25, like between 12 and 25,000 people in terms of the risk area. And so because we know that we've been able to do that testing before on a mass level, and again, because we knew what the challenges were the last time we did that kind of testing, we just want to be very judicious. And talking with my colleagues, my regional medical officers of health, the epidemiologists, speaking with the regional health authority staff, and you know, everybody involved in trying to get this outbreak under control. And the fact that there is community transmission right now is really what's the impetus for doing that testing.
Thank you, Dr. Mr. Jakes. Do you have a follow-up?
Yes, I do, and it's also for Dr. Russell. The mayor of Atholville and MLA Guy Arsenault felt that your comments and those of Premier Higgs earlier in the week were unfairly blaming Zone 5 for its misfortune, and would discourage those who are doing their best to comply, often under very trying circumstances. Given you have said the virus can show up anywhere, that we should not point fingers and that we should be kind to each other. Do you regret saying that?
Well, you know, this outbreak in Zone 5 has been challenging and heartbreaking in the sense that, you know, we don't want any area of the province to undergo undue stress and strain. You know, my job is to inform the public so they can take appropriate actions. I definitely would never have intended my comments to come across as blaming. Really and truly, the stress and worry and frustration that people have right now is real and is very normal. And it's very, very difficult. It's a very, very difficult time for that community. And so what we know is that, you know, going through a global pandemic has very dramatic effects on our lives, and coping with those changes and those things that we can't control, that are outside of our control, are really challenging in terms of our sense of well-being. So many individuals right now are challenged with this and have been all along. So I am very sorry that New Brunswickers are bearing so many hardships. I mean, particularly in Zone 5. It is very challenging, and I would like my message to be encouraging, optimistic, and educational in a way that increases understanding and cooperation and results in protecting our entire population from COVID-19 and all the negative aspects and impacts that can have on our mental health, our income, our economy, and our social connections. So again, my job is to inform the public, to allow them to take actions that protect their health and the health of their community.
Thank you, Mr. Jakes. Thank you, Doctor. Pascal Rachnog, l'Acadie Nouvelle.
Hello. My question is to the Chief Medical Officer of Health. So as of tonight, Zone 5 will be in the orange phase. Is public health thinking about more restrictions to limit people from Zone 5 to enter and leave the region? No, not for now. Our advice and our directive is to not travel to this zone unless it's for essential reasons. I think you have all the details on our website. We just don't want people to travel there for non-essential reasons. We don't want people to travel outside of the region for non-essential reasons. Thank you. My follow-up is also for Dr. Russell. I would like to know what could trigger a return to a red zone in the Restigouche region. Could you please repeat the question? Yes, of course. So my question is to Dr. Russell. I would like to know what could trigger a return to the red phase for Zone 5. So what event, what number of cases would trigger this return to the red zone? So we will revisit all the information that we get every day for the next 5 to 7 days. If we see that all the measures that we implemented up until now, because the change that we're making today is that we want that people only have a one family bubble. And with the wearing of masks, with the testing, and the effect of testing, the effect of the wearing masks. If cases keep going up, it will take, well, there are 3 categories that we have used to get back to the orange phase, and those categories are the same ones that we will use to determine if we see changes, meaning if the number of cases keeps going up rapidly, if we see more people being hospitalized, and that it causes issues and challenges for the hospitals and the services that can be offered, and if the number of close contacts can diminish, because we've seen people have been in close contact with 10, 20 people, and that makes it very hard to do the contact tracing very fast and efficiently. So if we could limit the number of close contact, means that the contact tracing can be done very quickly and people can be isolating very quickly, and the people who will isolate for 14 days, the number of people who will have to isolate will go down, because right now there is a very large number of people who have to self-isolate, so it affects the hospitals and schools. So if we can do the contact tracing as fast as possible, we will see results in the next 5 to 7 days, and then we will be able to decide if we are going in the right direction and if we really stopped the transmission of the virus. We want to stop the transmission of the virus immediately, but it will take a few days to see the results. Thank you.
Thank you, Bruce. For Dr. Russell, are healthcare workers currently working in more than one nursing home across the province, and if so, why?
So this is a topic that's been on the table since the beginning of the pandemic, and we have worked very, very closely with social development to make sure that every single nursing home, long-term care facility, and ARF, adult residential facility, has an outbreak management plan and protocols in place to protect the safety of the staff as well as the residents. Now, because again, every type of facility is different in terms of what types of expertise they have and what types of layout in terms of how the rooms are and if people share rooms, the level of cognitive ability with respect to people with dementia, et cetera. There are many challenges that face different types of facilities, but certainly in an outbreak setting, there is no movement of healthcare workers from facility to facility. So, and again, we have worked very closely with social development from the beginning, and again, because we keep learning from each outbreak with respect to now having EMP and involvement with respect to the prompt teams, we are really, again, continuing to build on the guidance that we've already given them, and the workers are involved in that, and because we've done some auditing with them, we are helping them target the places that need extra help in terms of managing all of the direction that we've provided so far.
Mr. McInnes, do you have a follow-up?
I do, and it's for the Premier. Premier Higgs, has any thought been given to reworking the recovery phases to allow for fewer restrictions on businesses while we're in these phases?
I think that's a good question, and yes, there have been thoughts given to that, and I think it's because the more we see businesses following public health rules and doing so diligently, it allows us to think about, okay, if we have to make significant changes, what businesses are most impacted, and how have they shown, and how can they mitigate the changes. And I think many businesses have been exemplary in how they've managed and protected the public, and at the same time allowed their business to keep rolling. So yes, we've learned from that, and that is a consideration, and I think it'll continue to be as we evolve, because our goal is to try to do both, protect citizens and provide, ensure they have a livelihood to live and survive within as well. So it is very much under active consideration. Our compliance checks will allow us to learn from where things maybe are doing really well in how they're protecting, advising others, and keep us moving in a positive direction.
Thank you, Mr. McInnes. Thank you, Premier. Shelley Steeves, Global.
Yes, thank you. My question, is for Dr. Russell. Dr. Russell, we're returning back to phase yellow in zone 1. I'm just looking for an update on what the situation is at this point at La Manoir. Are we still seeing, is there still staff there? Is there still public health staff helping out to care for the residents? Are we still seeing ongoing testing there? And I know before we moved into the orange phase when the outbreak first started at La Manoir, we saw some of the senior care facilities in the region start to really tighten up their restrictions. So I'm wondering, even though we're going back to the yellow phase, what your recommendations are there.
So basically, how things are going at the Manoir is that they are going in the right direction, and we're pleased with the help from the prompt teams and EMP. So mass testing was recently performed this past Monday on all the residents and employees, and all the results came back negative. So in that regard, it's going well, and we're pleased with how things are going in terms of the ongoing care in that facility.
Steve, do you have a follow-up?
Yeah, so the recommendation is that for other senior care homes in the region, as we go back to the yellow phase, that basically kind of business as usual for them with respect to visitation in the yellow phase.
I don't have information on what the other facilities are doing in that area, but my understanding would be that in the yellow phase, they have their protocols based on that phase. So in terms of visitation, that would be the guidance right now.
Thank you, Ms. Steeves. Jean-François Boisvert, l'Acadie Nouvelle.
Jean-François Boisvert, l'Acadie Nouvelle. My question is to Dr. Russell. Could you explain to me what will the mass testing do in Zone 5? Wouldn't it been more relevant to do this earlier in the outbreak rather than asking people to gather there en masse? because maybe they will get in contact with the virus there. Isn't that more dangerous? Well, we had different results, and that's what informed us to make this decision. Like I said earlier, the fact that there is community transmission, this is what concerns us the most now, because we were not able to find the link with the outbreak as such. So there are 4 different chains that we cannot link to the outbreak. So that is concerning, and that's a very recent, the 3rd case that is not linked happened this week. So we are doing the contact tracing, and it took us 24 to 48 hours to determine that we couldn't find a link. So we had to give time to the contract tracers to determine that they couldn't find the link, and we are asking people with no symptoms to get tested, and the people who have symptoms already have to call 811 or go online, and close contacts should have been tested had it been recommended by public safety. So I think all the close contacts were tested, even though they didn't have any symptoms. And as for people who didn't have close contacts, so should be tested. And now we are offering testing for the people who are asymptomatic, but people who will take the test will have to self-isolate until they get their results. Do you have a follow-up? As for Kedgewick, are they in the yellow phase or are they in the orange phase? There are 2 places where we had to change the zone because of the level of risk. So Belle-Dune is included in zone 5, and Kedgewick will not be included in zone 5. It's really about the difference in risks in this in this outbreak. Thank you. Carl Smith.
Thanks, Bruce. Question for the Premier on a different course about transit, actually. Premier, I know several months back you said municipalities could use safe restart funding for transit, but at the same time you denied federal money specifically for transit. Now, Moncton is laying off Kodiak Transpo drivers, and we know many municipalities are facing revenue shortfalls, obviously. So what will you do to support municipalities in the transit situation, and is it too late to get federal money?
Well, firstly, a correction. I never denied any funding for transit, so that's not a fair statement. Secondly, we did receive money from the federal government for COVID restart, of which 40 million of that was related to municipalities. And it wasn't all for transit, but the municipalities, the main areas for that have transit, have put in requests. I think the total requests are about $6 million right now. We said that we would fund that even before the federal money came, and in fact that is underway, and the facilities, the municipalities should expect to receive their money next week.
Thank you, Premier. Mr. Smith, do you have a follow-up?
Yeah, I guess just to clarify, so opted out, I guess, is fair for the transit, but for Dr. Russell on the second question, I think you answered this in French, Doctor, but I'm wondering how close Zone 5 is indeed to the red phase. I see the criteria on the government website, and I thought you mentioned there are 3 instances of community spread, but how close are we to meeting the requirements to go back that alert level, and what are the protocols that are closest, I guess, to tipping the scales?
So I'm still here just on the latter part, just for further clarification. So the second level of transit funding was for big cities, for subways, infrastructure, and trains, and that sort of situations that we don't have. So it wasn't a case of opting in or opting out. It was a case that we do not have that sort of infrastructure here in New Brunswick. Thank you.
Thanks for clarity.
Yeah, so with respect to the red phase and the orange phase and what we're seeing with community transmission, we are close to being able to go in the red zone, but we really wanted to give the community a chance to see what the next steps with respect to the measures that we're imposing today will have on the outbreak situation. Again, we are continuing to work super hard to contact trace everyone and make sure everybody's self-isolating. And basically, if you're not going to work and you're not going to school, you're not getting groceries, you should really stay home and not have any interactions with people outside of your home.
Thank you, Doctor. Thank you, Mr. Smith. Nicolas Steinbach, Radio-Canada.
Bonjour, merci Bruce.
Thank you, Bruce. My question is to Dr. Russell. Could you repeat in French what you want to do with essential workers who cross the border? You mentioned that they would it would be on a voluntary basis. You said 3 times a week. So can you tell me when it is going to take place? In French, yes. And the question before yours, I believe your colleague wanted me to repeat in English, and I didn't repeat everything. This is a voluntary strategy for essential workers who work on one side of the border, who live on one side of the border and work on the other, whether it be with Quebec or the United States. They can get tested voluntarily 3 times a week. We cannot eliminate risks in the province. The number of cases is going up a lot outside of our borders, in the U.S., in Ontario, in Quebec. I cannot change the risk outside of the province. All I can do with what we can manage is to increase testing, and this voluntary manner to test will limit the risks a little bit, but will never eliminate them completely. And when does it start? Immediately. Immediately. My second question, Bruce, my follow-up question is to Mr. Higgs. Today we are seeing 22 new cases in the Gaspé region. Are you pleased with the measures that are taken in Quebec and in the Gaspé region, or are you concerned?
I'm very concerned. We had what we were trying to create was an extension of the bubble into Louis-Squay, and because the communities were so closely tied with the communities in Northern New Brunswick, and unfortunately, we couldn't get the security around the borders. And my discussions with Chief Gray were very, very productive in how we could manage and keep that open. But because we couldn't get the highway security that we wanted from the Louis-Squay community into Quebec, we were unable to keep our border open from between our 2 communities in New Brunswick and Quebec. So that I am very concerned, and the level of outbreak in the province has certainly led us to be more vigilant. I'm speaking with my colleagues, in PEI in Newfoundland and Nova Scotia. They recognize we're on the front line, and our regions and certainly in northern New Brunswick, northwestern New Brunswick are right there. They're so border management is crucial, and we will continue to be diligent in that regard.
Merci, M. Steinbach. Merci, M. Premier Ministre. Doug Dickinson, Bugle Observer.
Hi, this is a question for Premier.
the Heartland Mayor and CAO refrained from wearing face masks or any PPE at a public council meeting Monday night. What expectation does the province have for municipal staff wearing masks at indoor public meetings? And have these guidelines been communicated to municipalities? What actions can the province take if municipal leaders ignore or refuse to adopt public health measures?
Well, it all depends if they're in the yellow phase or the orange phase, and we have very detailed Q&As and detailed information about what indoor masking for the public means in public spaces and offices. So the rules around if you're in a hallway, if you're in a cubicle, common areas, that the guidelines for masks have been sent to the municipalities, so they have that information. And again, we can only encourage people to follow those recommendations. Obviously, we're trying to protect everyone in the entire province. And again, the difference between masking indoors in yellow and orange and masking outdoors in the orange phase, again, we're just trying to do our best to protect everyone.
Mr. Dickinson, do you have a follow-up today?
Yes, I was just wondering what the Premier's thoughts are on that, in that incident.
I guess the only thing I would add in that sense is, you know, we expect others to follow protocols, and we know how important it is, and we've stressed it over and over and over again in these events and others. And so, you know, I know it's inconvenient for all of us, but it's important that we lead by example. And we'll always have moments of I guess we'll be corrected in one way or another, but it's if we're going to expect others to be diligent and follow the rules of public health, then we must be examples of that. So that's the only comment I would make.
Thank you, Mr. Dickinson. Thank you, Premier Geneviève Normand, Radio-Canada.
Geneviève, Radio-Canada.
Jordan Gill, CBC.
Yeah, this question's for Dr. Russell. We've been told a worker at Nouveau-Brunswick Power's Belledune Generating Station has tested positive for COVID-19. Is that why you've included Belledune in the tighter restrictions? And what is happening with the other workers at the plant?
For confidentiality reasons, I don't really want to comment on any of the situations. The decision around Kedgwick and Belledune in terms of how they're included or not included in Zone 5 was based on our risk assessment.
Mr. Gill, do you have a follow-up?
Yes, it's also for Dr. Russell. What do you know about the fourth person to die during this pandemic got the disease, or were you even able to finish the investigation into that case?
The contact tracing for all the individuals up until this point in time has been done on all the cases. So we've contact traced all the cases with probably the exception of anybody who was diagnosed as being positive today.
Thank you, Mr. Gill. Tom Bateman, Times and Transcript.
Hi there. Probably for Dr. Russell. Is it essentially too late to realize or to understand where the Zone 5 outbreak started? If the contact tracing is done and there's still, evidence of community transmission in several cases, has that ship failed essentially?
Well, that's what we're hoping to find out in the next week in terms of how well we can get things under control. Really, it is about controlling people's movements and limiting the number of close contacts in terms of the R factor. So this COVID-19 has an R factor that's quite high. In some cases, it can be up to 6 people can be infected just by one person. And the only way to change that R factor is to have the number of people that each positive case can infect be 0 or less than 1. That's the only way to stop transmission and stop an outbreak. What we saw this past summer with people who were coming in for as temporary workers and international students because they were under the Federal Quarantine Act and we were following them very closely, we actually made sure they were self-isolating appropriately, and we tested them each on day 10. And anybody who tested positive during that self-isolation period could not transmit to anybody else. So we had no outbreaks as a result of any of those positive cases that came in during that time under those situations and circumstances. So again, ideally, I would love it if every single person was self-isolating at the time of their diagnosis, but in this situation, it's not been possible. But by imposing the measures we're imposing today, again, it's kind of another strategy that we have that we can use to, again, decrease the number of close contacts and stop the transmission.
Mr. Bateman, do you have a follow-up?
Yeah, slightly different note, and I think this was discussed earlier, but I'm on a terrible phone line here. Just with regards to businesses who are coming out of the orange zone now and moving into a yellow zone, how open are you, Dr. Russell, or Premier Higgs, in having discussions about changing the restrictions that prevent some businesses, spas, and that sort of thing from opening? In the event of another orange phase, which is probably somewhat likely within the province. Can those discussions start happening now that we're into this new phase here in Moncton?
Absolutely. We have actually already revised the red, orange, and yellow phases at least once, and that's posted on our website. And because this pandemic is going to be a continuous learning experience, every single time we have outbreaks, every time we see transmission patterns, we will continue to use that information to inform our decisions moving forward and include that information in our decisions around making any edits or changes or revisions to our phases. But we definitely have met with the Cosmetology and Barbers Association this week. So again, more to follow, and we will continue to evolve our approach as we continue to evolve our learnings. Oh, Vicky.
Vicky Hogarth?
Yes?
So the St. Stephen Assessment Centre is by appointment only. So when the request comes into St. John, et cetera, the scheduler offers a scheduled appointment to Charlotte, to be referred to Charlotte County.
Thank you.
Thank you, Doctor. That concludes today's update.
Voilà la fin de la mise à jour d'aujourd'hui.
Cela conclut la séance d'aujourd'hui. Merci. Thank you.